Hey Alex, my name is Nick and I'm going to be your provider today, okay? And what we're going to be doing is I'm going to be doing a head to toe assessment on you. So what that means is I'm going to start at your head and check out all of your body so we get down to your toes just to make sure everything's working correct, okay?
Okay.
Now we're going to start on your head. Now is it okay if I go and touch your head like this? Okay. Now I'm going to start by palpating your skull, okay? And what I'm doing right now is making sure that there's no bumps or bruises. That doesn't hurt, does it? And I'm also looking in your hair, making sure you don't have like peanut butter, gum, any bugs or anything living in there, which it doesn't look like there is, which is awesome, okay? Now that we're done with that, I'm gonna move on to your ears. Is it okay if I touch your ear real quick? Okay. Does that hurt at all? No? I'm gonna check out the other side too. And what I'm doing right now is just making sure that there's no obvious lesions or pain and that they're symmetrical on both sides. Now this is also when, and I apologize because I forgot my tools, I would take a look in your ear. Is it okay if I take a look in your ear real quick? I'll have you scoot up for me just a little bit. Okay? And then pulling the pin up and back. I would then observe his ear canal through. And what I'm doing when I'm looking in there, buddy, is I'm making sure that it's not red and angry, right? That you don't have any cuts. And I'm looking at his tympanic membrane, making sure that it's that nice pearly gray translucent, which it is in this case, right? Your ears don't hurt at all, do they? And you're hearing me okay? We're gonna do what's called a whisper test, all right, buddy? So I'm gonna have you plug your ear like this, and I'm gonna whisper something, and you tell me if you can hear what I say, okay? Dog. Okay, now we're gonna do the same thing, cover this ear, and we're gonna do the other side, okay? Good job. Okay, now I'm gonna take a look at your eyes real quick, okay? Okay, so we're gonna pretend that I have my tool, and what I'm doing is I'm flashing a light into your eyes real quick. And what I'm doing there is I'm looking to see if that red light reflects back at me, huh? Which it is. And I'm gonna check the other side too. Perfect, okay? Now, the next thing I'm gonna do is I'll have you sit up, and I'm gonna go like this to your eyes so I can look at the inside. Is that okay? Okay. Yep. Oh, perfect, buddy. So what I'm doing there is making sure his conjunctiva is that nice pink color, that it's not inflamed, that it's not angry, and that there's no abnormalities or bugs, insects, purulent drainage, or anything like that in there. Which there isn't. Your eyes look great, buddy. And I'm making sure the sclera itself is nice and white, which it appears to be. Okay, buddy. Now the next thing we're gonna do is I'm gonna have you follow my pen for a second, okay? So I gotta have you sit completely still, and I need you to follow my pen, but don't move your head like this, only with your eyes, okay? Good job, try not to move your neck. You're doing good, we're almost done. Okay, one more time. And perfect. What I'm doing right there is making sure I'm testing your cranial nerves, buddy, to make sure your eyes can track that okay, right? Which they're able to, and there's no rapid eye movements or nystagmus present, okay? Now there's a couple other vision tests we would do for cranial nerve too as well. Sort of to test visual acuity, we would use the Snellen chart. I don't have one here with me, but we would perform that test 20 feet away, have him read off the smallest line that he could with both eyes, and then compare the two as well. We also do, I'd have you cover one of your eyes like this for me. We're not going to do this test because it's kind of complicated. But it's a way we test for visual confrontation, which also helps with cranial nerves 3, 4, and 6. Okay, buddy. Now, is it all right if I take a look at your nose?
Yeah.
Okay. So it's all right if I go and palpate your nose like this?
Yeah.
Does that hurt at all? No? And now we're going to pretend I have another flashlight and I'm going to look up your nose, okay? And when I do this, what I'm looking through is checking for excess mucus. Again, anything that might be impeding the airway at all, any bugs, beans, little small things kids can shove up their noses. And I'm also making sure that it's patent and he's not deviated by any means, which is the case. Okay, now I'll have you sit up right in front of me and let's check out your mouth next, okay? I want you to say, ah, and stick out your tongue for me. Good job. Now what I'm doing when he says ah is I'm making sure that uvula is midline and that the tongue doesn't have any obvious wasting. I'll have you open your mouth for me again, buddy, so I can take a look at your gums and your teeth to make sure you have all of those. There's no lesions or anything on the gums. Do you have any pain with your teeth? Your teeth don't hurt? No? Good job, okay? And then after that, the next thing that I'm gonna wanna do is I'm gonna have you repeat some movements. We're gonna check cranial nerve 12. So can you stick out your tongue at me like this? Now make the same movements with your tongue that I'm doing, okay? Good job. Okay, making sure that cranial nerve is perfectly intact. And then I'll have you say 3 words with me. Can you say light, tight, dynamite? Perfect, okay? Now let's check out your lymph nodes, okay? So I'm gonna have you sit up for me just like this. And I'm going to check your preauricular, postauricular, occipital, parotid. Hold on, buddy. I'll tell you in 1 second what I'm doing, okay? Submandibular, submental. So I'm checking your lymph nodes because when you get sick, it gets swollen right here sometimes. Tell me, what is it? Uh-huh. When we were playing that game, here, let me check your neck. Let's look up just like this. And it's midline, no deviations at all. Does that hurt? No? Perfect. Okay, buddy. Now the next thing I'm going to be doing is I'm going to be listening to your lungs, okay? So I'll have you put your back right here and face that way, okay? If you can, I'll have you spin around. Can you sit crisscross applesauce the other way? Yeah. All right, we'll start in the front then. And now I forgot my stethoscope, so I apologize. So what I would be doing now, auscultating the front of the chest, right? So we're going to be giving your lungs a listen to real quick, okay? So we're going to pretend I have my stethoscope. And take a deep breath for me. And then another one right here. Perfect. Another one right here. And another one right here. And what I'm going through is making sure that you're breathing appropriately, right? And that all that is okay. Okay. Now I'm going to have you, let me check out your back for a second, okay? So I'll help you sit up. Yeah. And then I'll be doing the same thing, listening posteriorly, right? So I'll give you a deep breath for me. And another one. And another one. Perfect. Going in that ladder type motion, right? Now the next thing I'm gonna have to do, buddy, is I have to tap on your back kind of like this. Is that okay? Can you sit up like we were? And the reason I'm doing this is because the sound that your back makes when I do this, well, it's okay, breathe normal, okay? Will tell me if you have any liquid in your lungs, right? Or if it's hard to breathe. Do you ever feel like it's hard to breathe sometimes? I know, it tickles a little bit, huh? Okay, all done right there. No abnormal sounds. Everything sounds the way it should, okay? Now I'm gonna put my hands across your rib cage. It was, huh?
That was tickling.
Now take a deep breath for me, okay? Good job. Okay, now I'm gonna have you lay flat with your back down right here, okay? And we're gonna look at your stomach next. Okay. Now is it okay if I pull your shirt up and look at your stomach?
Yeah.
Okay. I'm gonna move your shirt up. Okay. First thing I'm doing, making sure there's no injuries, any pulsations, any abnormal bruising. And now the next thing I'm gonna go through is I'm gonna start and I'm gonna feel different parts of your belly. Just breathe normal, okay? And I'm just gonna tap on your belly like I was on your back. It might tickle a little bit, but you tell me if that hurts at all, okay? Doesn't hurt? Okay, good job. The next thing I have to do is I have to feel on your tummy a little bit, okay? Again, try to stay still for me. That doesn't hurt, does it?
Yeah.
Okay, right there, nothing? Here? Doesn't hurt? And so what I'm doing there is that deep and light palpation is making sure that there's no abnormal masses, right? Checking for any tenderness over the liver and the spleen as well. That would come upon palpation. Okay. All right, buddy. Now the next thing we're gonna do is we're gonna go through a couple range of motion exercises, okay? So we'll start, I'll have you sit up for me. And first we're going to do, I'll have you sit right here in front of me. Can you shrug like this? Good job. Now can you sit up straight? Can you shrug with my hands on there? Now shrug up and push my hands. Okay. And now let's see, can you move your head left and right for me like that? And now we'll look up and then we'll look down. Does that hurt your neck at all? No? Okay, now we're gonna do some movements with our arms, okay? I want you to hold your arms out, but you can stay sitting down. Like this. Can you go like that? All the way up? Now down. Now hold your hands in like this. Now let's go out. Now back down. Does that hurt at all? Go like this. Now go behind. Okay. Now hold your hands out in front of me like this. Now spread your fingers out wide. Now close them in. Now can you go up? Now go down. Does that hurt at all? No? Okay, now lay on your back. We're gonna do some movements with your legs, okay? You found the TV remote? Okay, now bring this leg up. Good job. Now let's put this one down. Now bring this one up. Good job. Does that hurt at all? No? Okay, now bring this leg, this one right here, bring it out. Good job. Does that hurt at all? Now let's rotate and let's bring that leg out too. Now let's, perfect. Okay, good job. Okay, now I'll have you sit down at the edge right here and then dangle your feet over the edge for me. Scoot up a little bit, buddy. Just like that. Now a little bit closer. Good job. Now can you kick that leg up? Nice. Now this one. Okay. Now I'm going to check one of the pulses on your feet, okay? Checking his dorsalis pedis. Now on both sides. I'd say +2 bilaterally symmetrical, so no issues right there. They're nice and strong, okay? I got to check a couple other of your pulses though. Okay, the next one I'm going to check is right here in your wrist, like that. Can I see your hand? Perfect, buddy. Okay, now let me see the other side. Good job. Again, +2 symmetrical bilaterally. Now I'm going to check the one, your carotid, which is up here in your throat, okay? So I want you to sit up nice and tall, okay? Okay, buddy, now I'm going to check the other side, okay? Oh, careful. Okay, perfect. Now I'm going to have you, we're going to do some walking exercises real quick, okay? So come and stand next to me, and we're going to walk just like normal to the other side of the living room, okay? Making sure that his gait is stable, there's no issues there. Okay, and now this next time when we walk back, wait, come back with me. We're gonna go like this, okay? Heel to toe. Can you do that? Let's see. You got it, a little bit? A little bit unstable, but at his age, no abnormalities to note right there. Okay, buddy. Now we're gonna do a couple more tests, okay? I'm gonna check your reflexes. Now if I had my reflex hammer, I'll show you what that would look like. We'll walk through theoretically where those placements are, okay? All right, Alex, I'm gonna have you, we're gonna check your reflexes, okay? So the tricep, now you just let your arm relax for me, is located right here. I'd strike and then see how he'd react. The same thing with the other side. For his, let's see, we also have to do the one on your knee, buddy. So I'll have you sit down for me. Perfect. Now have your feet dangle off the edge again, okay? And so this is where I would strike. Here, have your legs be perfect. Just like that. Where I would hit right about here and here. And see how you would respond as well. And the last one that we do is the Achilles on a pediatric patient, which I'll have you sit down for me again, buddy. And then I would support the bottom of his foot and then strike here to see how that would react. And again, the same with the other side. That's good, buddy, because it's not supposed to hurt. That'd be bad if that did hurt. So I'm glad that it didn't, okay? Now, all right, buddy. I believe that is everything. Thank you for all your help.